What's going on, everybody? Dr. Andrew Fix back here for another episode on the code. Really appreciate your time tuning in, listening to our show, however you're tuning in, whether you're in the car, you're on YouTube, or you're listening on one of the many podcast platforms. We really appreciate you jumping on for this episode. Very excited for another interview for you guys. We've got Kathleen Heiney joining me. She's one of the founders and owner of Regen 3 Therapeutics. She's also been a client here in our office at Physio Room and here in the gym, Lions Den, that I'm standing inside of. And I'm excited. We're going to get into the topic of Shockwave today, and some of my personal experience with it, Kathleen's personal experience with it, how it kind of fits in the puzzle of rehab and helping people get back to feeling their best for all the sports and activities they love to do. But Kathleen, thank you so much for joining me here on the code.
Hey, awesome. So let me just tell you a little bit about me and kind of
Yeah.
my background. Yeah.
Yeah,
Okay.
if you could do us a favor, just more thoroughly introduce yourself. You've got a master's in kinesiology. We both got this like Midwest background in us here a little bit. So yeah, if you could tell us more about you, and then we'll end up getting into the shockwave and rehab side of things.
Okay, cool. So, yes, from the Midwest, graduated from graduate school in 94 from IU with a master's in kinesiology. My initial work was working with people with disabilities, but really just studying movement. And I fell in love with movement at a very young age as a young athlete, all those great things that you do as a kid. I launched my first business called LINC Golf and Wellness in, oh my gosh, 2005. I think I just celebrate, well, right, early 2000s, but just celebrated 20 years of
Awesome.
being an LPGA teaching professional, golf professional, teacher, coach, which I love to do. I love to teach. I love to coach. Been in the fitness industry my entire life. So really just movement, like you probably, has been my world. The shockwave piece, I kind of stumbled upon. I had a micro tear in my Achilles when I was teaching yoga, probably too much yoga, practicing too much yoga. I have a little bit of hypermobility, so I create a little micro tear. We could talk a little bit about that.
Yeah.
And I was trying to find a podiatrist. And so I came across a podiatrist who had just started using radial shockwave. And we'll kind of get into the different types of shockwave and the history of shockwave. And I went and saw him, and he did the first treatment, and I about jumped out of my skin. I didn't know what was happening. And I was like, oh my God, this is so painful. And he's like, but it's going to be great. Come back. We're going to do like 3 treatments. So
Yeah.
he had the radial device. So he then became my podiatrist, because I think everybody needs a good podiatrist because feet are important. And I proceeded to start doing shockwave with other parts of my body. He then proceeded to purchase the focus device and then another device, which is called the magnetolith. Fast forward, I had, golfer's elbow in both elbows from teaching and playing a lot of golf. I had some shoulder issues. I had a sprained ankle. I broke my hand. So I continued to use him, and I just fell in love with it. I was like, oh my God, this is amazing. Like this technology, non-invasive, hardly any downtime. You're getting your
Yeah.
body to heal. So I started thinking to myself, as I was referring so much business to him,
Yeah.
I started getting Shockwave for free. And I thought to myself, okay, so why am I not starting this business? And being an entrepreneurial by heart, I love building businesses, doing business development. And so I was going to partner with him. That didn't work out. I had another idea with another business partner. She wanted to open up an entire wellness center. I was like, no, no, just something basic.
Yeah.
So Dr. Eric Wonkowski, who's a chiropractor, our kids dance together. I approached him and I said, hey, I really think this is something that you need in your office. And we started with 2 devices, and now we have all 3 devices, and we've been in business now for about a year and a half, and
Yeah.
we're still learning. Shockwave is still a little bit of the wild, wild west. Every time we sit down in a meeting, we're continuing to talk about different protocols and how people's bodies heal and integrating, like the physio room and physical therapy and personal training and all that kind of stuff. So I'm totally obsessed with it. You ask my family, that's all I talk about.
Yeah.
But I think I'm obsessed with it because it can really help a lot of people. And what I'm learning through people like you and in the industry is, not everybody needs to go under the knife. I would say a lot of people don't, with, small tears in the shoulder or whatever it is. And there's a lot of ways that we can rehab our body, and combining like the physical therapy and the shockwave is just one modality. And that's why I'm kind of doing this podcast with you, to really educate people on these things, and because I'm so passionate about it and I want people to feel good.
Yeah. Yeah. I'm right there with you. And I think I think what's really easy for to happen to people, to providers in particular, or coaches or trainers, people that are working with other clients, is to get kind of like pigeonholed in your lane, right? Like as a physical therapist, I know the things that I know and I know them very well. And it's very easy to think about like, well, here's the tools that I have at my disposal to help this person in front of me with the issues that they're dealing with. But at the end of the day, none of us, physical therapists, chiropractors, providers that do shockwave, physicians, orthopedics, whomever, we all don't know everything. And we all don't have a expert level understanding of all of the different categories because that's just not realistic. Like if you really want to be an expert in one field, it's there's not enough time in the day or knowledge. Like you can't do all of the different things. That's why nobody does that, right?
Right.
So, anyways, what I think is really fun and eye-opening, and it's a great learning experience, is when you take one of those providers and then they've gone and had their own personal experience in those different categories. Like we're gonna get into Shockwave, but like I didn't really know too much about it until I went in for a Shockwave appointment and experienced what a radial shockwave machine was like. And then now I've been in to see you and Dr. Eric and experience what a focused shockwave appointment is and whatnot, and like understanding the differences of those things. I think at some point in the future, it's realistic that we probably have shockwave devices in our office at Physio.
Mhm. Yeah.
But why don't we just start there in like, for people listening to this who may not have an idea, like what the heck is shockwave? And how would you explain it or compare it to like the other things that are out there? What is shockwave and how does it work?
Well, the history of shockwave is really kind of fascinating. In the 70s, what they did was in order to break up kidney stones, they put people in a tub of water and applied acoustic sound waves through giant tubes into water. And because it has to have that conduction through the water. And so after they had to do more than like one session, because this was like in 1973. So as they did multiple sessions, after the kidney stones had dissolved, people were finding that the side effects of being in these acoustic sound wave baths, which I wish we could do that now, was soft tissue repair
Mm.
because of the acoustic sound wave ability to recruit stem cells and cellular proliferation. So that's kind of the history of it. So they kind of stumbled on it. And moving forward, they then created the radial pressure wave, which I'll kind of get into, but there's two types of shock wave. The first is radial pressure wave, which is a pneumatic device where it has like a bullet and it creates, it's percussive, which I'll kind of demonstrate here in a minute. I'll just kind of go over it. And that is more of a broad wave, right? So it's about 1.5 to 2 inches. So as the wave penetrates through the gun, it gets broader and wider, but doesn't go as deep. So it covers more surface and creates what we would call somewhat of, a little bit of a microtrauma. So sometimes what I tell some of my patients is it's kind of like microneedling all these little spots, or not microneedling, but dry needling,
Yeah,
microneedling
yeah.
is for your face.
Yeah,
So
sure.
like dry needling, right? And so it kind of creates those like micro trauma to tissue. And correct me if I'm wrong, because I know there's some controversy on around this, but if I do have an injury, the soft tissue can become kind of calcified. Is that correct?
Yeah, I mean, basically, the way I like to explain it to people is say you have an injury, your body's always in this state of like it's trying to repair. Like your body's
Right,
trying to heal damaged tissue or damaged whatever it is, a joint irritation or something. And the body's going to try to lay down collagen fibers or more bone if it's a bone
right,
injury we're talking about. We're going to develop scar tissue, and yes,
right,
sometimes in a tendon, for example, sometimes that can start to take the presence or take the appearance of like a little calcification type of spot
right,
where the injury was. Yes,
right.
yeah. Hmm.
So, and then how again, because you're more of an expert in some of this than I am, but then what I see is once that, let's say it's a small trauma to the shoulder, and then that tissue just keeps becoming more immobile, and then the scar tissue and it just keeps building. So then the mobility is limited, and that's when pain just sets in, and then it's become that's this chain reaction.
Yeah.
Right, let's say from an injury. So what the radial will do is it will kind of break it up, and I want to say subcutaneous because it's only like 1.5 inches.
Hmm.
So it starts to create that micro trauma to get the blood flowing back to the area so that the tissue can start to heal again. So we're kind of rebooting the healing process.
Yeah. Yeah. I
which
like
is part of,
that.
there's a little bit of inflammation there too, because blood creates that inflammatory response. So when people do some of these treatments, we want to encourage them not to do a lot of anti-inflammatories. Now,
Yeah.
if you're in a lot of pain, yes, that's fine, but should you be popping, 800 milligrams of ibuprofen when you're doing the shockwave? No, because it's gonna kind of negate what we just did.
Yeah.
And the focal wave, did you want to say something? Because I don't want to.
No, no, you go down the focused route and then I'll sort of unpack this and I want to kind of compare it and contrast it to dry needling like you were
Yeah.
just alluding.
Yeah. So then the focus wave, which is transmitted through water, it starts out really like a broad wave and then it gets narrower so it can travel deeper. So it's like it's a focal wave. And so then we can get to the deeper issues where maybe it is a labral tear or something deeper that we couldn't get with the radial. And then what the acoustic sound wave, the focus shock wave does is that when it gets to that deeper level, starts to really recruit the stem cells to the tissue to start the regeneration process.
Yeah. Yeah.
So you've got one that's broad, right? Like the secondary, like if you think of a dartboard, the surrounding area, right? And then the focus wave will go, it just goes deeper.
Bullseye.
And if you can go deeper, it can heal more getting deeper into the tissue. So, like with some of these, let's say a lot of scar tissue from a knee replacement, right? Or a patella tendon or whatever, we can do it on the surface, but are we able to get really deep inside of the tendon? So
Yeah.
that's why we bring the two together. Now, radial alone works great for just a lot of the tendinopathies and things of that nature, but
Yeah.
it won't get to deeper issues like in the knee, like an ACL or an MCL or meniscus or anything like that.
Yeah, totally. And
Yes.
I think the way hearing you describe it that way is exactly how my experience has been as a client, feeling what it feels like.
Mhm.
Um, just like dry needling that you mentioned, like in the body always is in this constant state of like it's trying to heal, it's trying to repair and do things to bring itself back to that normal homeostasis state. Dry needling is the same thing. We're trying to create tiny micro trauma
Mhm.
to
Yeah.
facilitate a healing response, draw blood flow to the area and whatnot. Comparing that to like the radial, uh, the radial shockwave is just we can just choose a different depth, right? Like what needle are we using? How deep are we going into the tissue? Where are we eliciting that trauma? Versus, like you said, the radial shockwave is not going to penetrate as deep. It's going to be a
Yep.
more superficial, broader wave. And then the focused will be able to penetrate deeper. And how these things facilitate that kind of microtrauma and healing response is different because some, like dry needling, are penetrating the skin and then the
Mhm.
body's responding to that.
Yeah, that's true.
And then in a
Yeah.
example like shockwave, it's not penetrating the skin, but it's still eliciting that microtrauma, that kind of response for the body to heal and react to. When I've had it done, I don't know, probably a few dozen different appointments now for primarily for my Achilles is
Mhm.
right as you know. I've got what we'll call mid-substance Achilles tendinopathy. So mid-substance, if you think of the Achilles, like if this was the back of my heel, mid-substance is where like we're up in the meat of the Achilles as opposed to down, right where it inserts
The
on.
insertion. Yeah.
Yeah, and a little bit different. The What I actually found was I had an MRI and I had a partial tear in the inside of the tendon, what we call an interstitial tear. So in my experience in Kathleen's office and in another office, having shockwave, that radial shockwave, is like that's exactly what it feels like. It feels like a shock, like a zap on the back of my heel or on my Achilles, kind of zap, 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 and we'll go through a little demonstration, but it doesn't feel like that is penetrating very deep. Whereas when we did the focused treatment, I literally feel it right in my
Yeah.
Achilles. Like inside the Achilles is like where I feel the sensation being penetrated to or
Right.
directed to. So
Right.
they do feel a bit different. And it makes sense hearing you explain it that way.
I mean, one is like we had a client that called it spicy,
Sure. Hmm.
because it's like just a lot of little like zingers, and when the first time I had it was on my Achilles, which there's no fat on your Achilles. I was like, oh my God, that hurt so bad. And I remember the second and third appointment, I was like, oh, I don't know if I want to go back because it is uncomfortable, right? But it's such a short period of time.
Yeah.
I think your body also kind of gets used to that, and then your body does that. What is it called? That substance P,
Yeah.
It
Mhm.
is, so it kind of is a response like this. Oh, I'm going to send this like these pain receptors to that area, and you kind of get used to it because there's a little bit of a like a not a what is like more of an anesthetic, like a
Yeah.
numbing sensation, like a tattoo,
Yeah.
right? Yeah.
Yeah, I
So,
mean, for anything that's worthwhile, you got to maybe go through a little bit of discomfort to get there, right? Right.
well,
Whether
yes. Thank you for saying.
mentally, physically, emotionally, all the good things require a little bit of discomfort
Yes.
to get to
Yes.
that
100%.
great point.
Yeah.
So yeah, what when people are coming in the office to see you guys and you're going through Shockwave type of treatment, what are the most common things that you end up treating folks for?
I would say what the number one is shoulders right now.
Shoulder pain.
Yeah, shoulder. And we've had and you and I have talked about this because you're actually working with one of our patients now is, we're seeing some of these slap tears, mild tears in the shoulder. We always want imaging if we can. And most recently what we've done with some of this imaging, you'll probably appreciate this, is I was like, let's put it in Chat GPT. Like
Sure.
just to get like because you can kind of read it and they all kind of start to sound the same, right? When you look at MRIs, and we can talk a little bit about that. And this is just new experience for me. This is all new, but I'm like, is this just like the textbook MRI, right? When
Yeah.
people are reading it. So I think getting imaging is important because we had a patient who was first diagnosed with a slap one tear in her shoulder. So we did the protocol for that with the shock wave, and then she was getting physical therapy, and she was moving really nicely, and then she started going backwards, and we're like, what is going on? Ready to go get surgery. I'm like, time out. She's a golf client too, kind of a spaz. I said,
Mm,
please come back. She's like, I'm gonna go get a second opinion. Frozen shoulder.
yeah.
She was this close to going under the knife. So it's kind of like, so anyway, so shoulders, we see obviously a lot of knee stuff, more shoulder, like frozen shoulder stuff. I talked about this, with Sarah too, just this perimenopausal, menopausal lack of estrogen that really makes that capsule, as I understand it, really kind of hardens, so that mobility is limited. Hip stuff, low back stuff, but I would say shoulders and knees and probably forearms too. Those are probably the top three.
Yeah, so forearms, maybe, we're talking about that tennis elbow area, that golfer's
Yeah.
elbow area on the outside or
Mhm.
the inside of the elbow there, near that bony attachment. And I mean, you mentioned shoulders and knee. I mean, I think definitely in our office at Physio Room, very performance-based physical therapy practice. The most common things we see people for, low back, knee, and shoulder, right?
Yeah.
It's like, and then every provider on our team kind of has their own different specialty and what kind of sports and activities they love playing, and then they tend to attract similar clients. So by the nature of me enjoying running and lifting weights and stuff, I get a lot of lower leg issues, people with lower leg issues coming in the door, Achilles
Right.
or plantar fascia or whatnot. But in general, lower back, shoulder, and knee. I mean, it makes sense to hear you say shoulder and knee. These are areas that all of us are using a ton for all the different activities we love doing, and
Mhm.
a lot of load and stress goes through those joints. And if we're not doing everything we need to do to strengthen and keep those mobile and whatnot, we're going to sustain injuries and irritations in those spots. So, um,
And the
yeah,
shoulder's so
not surprised.
complicated, like, I mean, I've had, issues off and on. I'm grateful to have this stuff and, you and people that I work with. And it's usually right around 90%. But then there's also a maintenance to some of this stuff too, with some of this technology. If you do have a micro tear that we get you to like that 80 to 90%, we recommend maybe once every 3 to 4 months because the regeneration process is a full 12 weeks that it takes for your body to fully go through that cycle.
Mhm.
So if they want to come in just for a maintenance once every 3 months, we can typically keep the tissue in that regenerative state, which I think is really cool. Now, if there's other health issues, I'm learning a lot too. Like we're seeing people with autoimmune, we're seeing people with neuropathy. We do have some neuropathy protocols. That's a whole nother world of, is it working? Is it not? We have a couple people that have been seeing results, but as I understand neuropathy, it's never going to go away. But if we can get some of the sensation back into the feet, that's not the numbing, you might still have the discomfort, but you can be more mobile.
Yeah. Yeah, I'm glad to hear you say that like this regenerative process, this healing process is going to take like 12 plus weeks. I think that's something that maybe folks don't understand. And for everyone listening to this, hopefully this conversation helps you understand that better. The same thing is true when like say you're in our office and we determine that one of the root causes or root reasons why you have the symptoms that you have is a lack of strength and stability. And we determine, hey, we need to strengthen your hip, for example, or your quad to help this knee issue that you're dealing with.
Right.
We do not build strength over an extremely short period of time. That is not the
Right.
way that works.
Yeah.
It's going to take 12 weeks for us to truly physiologically build more muscle tissue. Now,
Hmm.
where that gets confusing for people, I think, is if somebody starts doing exercises or doing a fitness routine of some sort, they will feel stronger in a quicker period than 12 weeks if they're doing things consistently. Yes,
Hmm.
you will. That's because our nervous system is really good at adapting and changing to things quickly. When you feel stronger over an extremely short period of time, like if you've been doing exercises for, say, 2 weeks and your leg already is starting to feel stronger, what that actually means is your body is just doing a better job through your nervous system, recruiting, activating, and using the muscle that is already on your frame. Not
Hmm.
that you've actually built a lot more muscle in a 2 week period of time,
Right.
because
Right.
it doesn't happen that fast. And it really especially won't happen too if we're not consuming adequate nutrition and protein and this and that to like actually
All
give
those
your
other
body
things.
all those things that, getting adequate sleep, all those things that are going to give your body the opportunity to actually recover and heal and everything. So
Right.
so good to hear you say that, the same timeline is true, that like this healing cascade is going to take a
Yeah.
period of several weeks. It doesn't happen overnight. Kind of helps to set the expectation for people of like, what should I expect to feel? It's not like I'm going to get shockwave once and then all of a sudden tomorrow I feel magically healed like I
That
did
would be
a
that
year
would
ago.
be amazing, and we would be millionaires. It's kind of like as a
That's right.
golf player, people come to my lesson team like, I just really need help with full swing and consistency. And I'm like, if I could do that in one lesson, I would be a very wealthy woman. And
Uh-huh.
everything does take time. And we talked about this at the beginning, where I think that's the way our society is set up, is these quick fixes. And I love that your last name is Fix, which I just is awesome. But when Eric and I were meeting earlier today, I was like, I just feel like we have to, every time we see a patient, session one, session two, session three, we're not going to go, oh, are you feeling better after session one? I mean, they might feel a little bit better. After the radial, you're always going to have range of motion, right? You're going to get more blood flow. Things are going to feel better for sure. We are getting your body to get blood to an injured area.
Yeah.
But I always have to remind them that 12 weeks. So we do three, and then we do like a re-exam in another, let's say 4 weeks. So now you're at about that halfway, 6 or 7 weeks. And we want people to be right around that 60, 70% mark. If they haven't had any movement, then we have to take a pause and
Mm.
say, okay, is it time to do imaging? If they haven't done imaging, because some people don't do imaging. So they come in, I hurt my shoulder, we do some tests, we do the best we can. So we're also learning that, if the body is not responding at all, like zero,
Mhm.
then there could be underlying issues
Yeah.
systemically, right?
Yep. And it's interesting to hear you say that. The quick fix part, like I resonate with that so well because yes, that's what everybody wants. We live in this microwave society, this order things online and it gets shipped to your house the next morning type of thing, where we want something and we want it right now. And unfortunately, like we were just talking about building strength, tissue regeneration, that is not the way that the body works. Like it is impossible for somebody to have a true injury heal that quickly. Like that,
Yeah.
the body's going to take time. Like for the
Mhm.
example of like, say someone had a knee replacement, we tell people this is going to be a year-long recovery process. Now,
Mhm.
it doesn't take a year for the scar to, seal. The tissue's still remodeling. It doesn't take a year for the bone to heal, but like to truly gain the range of motion back, the strength back, the movement patterns, all these things, like this is going to take a while to relearn how to walk without compensating and whatnot. Um, but that's what people want. They want things to be fixed right now, and I get it. And I think that's why it's so common for people to, you know, take 800 milligrams of ibuprofen to get the symptoms to go away, to go in for injections and surgeries and whatnot, because they're thinking about like, well, if I can just get this thing fixed, then all my issues will be gone.
And
And I'm,
that's the word they use. Like we have to, for some, how do we get that out of,
yeah.
and I always say like, we're not really fixing anything. I mean, I don't know if you could say that, but we are regenerating tissue because for your function of your body to be better.
Yep.
And I know as I've gotten older from, in my 20s, now in my 50s, it's like my body doesn't recover like it used to. It does pretty darn well because I have the technology and I take care of myself and I'm very proactive. But that's the other thing is I always talk about this technology as we age, is our cells are really sleepy.
Hmm. Yeah.
And so this kind of is like, hey, come over here. Don't forget, there's this little spot that we need to attend to. So, but yes, and the cortisone shots, like those are the ones where I've had friends that have had several and they're just waiting to get their knee replaced.
Yeah.
Now, I think there's probably a point, and maybe you can talk to this more than I can, where remember I had a wrist thing when I started teaching yoga, and I didn't know what it was. This was, I don't know, 13 years ago. No, maybe 12 years ago. So I go to a hand guy, right? And we did one cortisone shot because at that time I didn't know what else to do. It just came out of nowhere. I couldn't be on all fours. And guess what? It went away and it never came back.
Yeah.
So I think I don't want to ever totally knock those things because I think maybe there is a one-stop shop on occasion, but maybe you can talk a little bit about like when I tell people what cortisone is, it's just a massive anti-inflammatory. It doesn't heal anything. It's
Yeah.
actually restricts blood flow,
Yeah.
right?
I mean, basically what you're saying, cortisone is a steroid, right? You're
Mhm.
getting a corticosteroid injection that is going to be an anti-inflammatory injected right to the area that we're trying to calm an area down, whether it's the shoulder, the knee, the whatever. Sometimes they get used as a diagnostic tool, right? Like say somebody has pain in their hip and the physician or the providers are trying to distinguish between like a few different issues and they're like, "Well, what is actually causing the pain, the symptom?" If they take a cortisone injection and put it inside the hip joint and that improves the pain, likely the source of the issue is inside the hip joint, as
Right,
opposed to outside the joint, all the muscles and capsule and all the things that are there on the outside of the actual joint, because those could cause symptoms too. But like you said, cortisone, it doesn't fix anything. It's an anti-inflammatory, it's strong, it's going to hopefully help decrease the symptoms. And there's a time and a place for those things, right? But
right.
but what most people I think know now, but they didn't know before, was if you continue going back again and again and again, and you keep getting cortisone injections, what starts to happen is you start to actually break down the tissue,
Mhm.
break down the joint or wherever this is being put, because our body needs inflammatory processes to heal things, right? Our body is supposed to have inflammation. That's why we're talking about using tools like Shockwave and dry needling to facilitate a microtrauma, facilitate a small inflammatory cascade in response to let the body heal. If we don't have that because we keep like blunting it with things like cortisone, our body's not going to be able to heal, and then those joint tissues will break down. So, like for example, if you take someone who's had numerous cortisone injections in their knee and their shoulder, they're much more likely to get arthritis in that joint than someone who never had
Yeah,
those things.
yeah,
Now, not even considering the fact that yes, if we've had injuries, we're more likely to get wear and arthritis of those joints. But if you keep getting cortisone injections, you're
yeah.
pretty much guaranteeing that you're going to
Yeah.
have arthritis down the road in that joint.
And aren't they generally like putting those shots in that bursa? I mean, those bursa sacks. Is that kind of where they put them? I mean, I guess it just depends.
Yeah, it just depends on like what issue the person's dealing with. Like if they're dealing with a bursitis, for example,
Right.
then yeah, in and around that bursa area.
Yeah.
If they're dealing with an issue inside the joint, like take the knee arthritis, for example, that you were talking about, they're going to inject that into the
Right.
knee,
Right.
in between the femur and the tibia there. But yeah, just depending on what tissue. But I know my dad has had this experience. I know other people, like you just said, who have had the fortunate experience of they're dealing with some symptoms. They get a cortisone shot, and then that area just feels great, and they don't seem to have issues with it. But I will tell you, that's not the common experience that people have.
Right.
Most
Right.
people will feel a temporary, 1 to 6 weeks relief
Yes.
period, and
Yeah.
hopefully during that time frame, they're doing things like physical therapy, like good chiropractic care, like working with a personal trainer, whatever, where they're actually working on addressing the root cause of why they developed those symptoms in the first place, whether
Right.
it's a strength issue or a mobility issue. Because if you can double down and kind of like, okay, if you're going to get the cortisone injection, well, let's take advantage of hopefully the period of time where you
Yeah.
do get some relief of those symptoms to actually fix the problem, because cortisone doesn't fix the problem. It's just like taking a high dose of anti-inflammatory medication. You're just not doing it orally, you're
Right.
injecting it. So,
Well, then I think, the word inflammation, right? That's like the hot topic. Oh my God, you have inflammation. It's you have a metabolic disorder because of inflammation. And I think what people also need to understand is that, we all have natural inflammatory responses in our body going on all the time. So when we talk about, at least when I'm treating patients, I always say, well, there is a inflammatory response. And
yes.
people kind of look at me like, well, wait,
Uh-oh.
no,
Yeah.
it has to happen in order for the tissue to start to heal because blood flow and inflammation, that's what heals the tissue. So I think that's also, there's so much out there about, oh, do you have inflammation? Are you on a diet with no inflammation? Do you have no inflammation? I'm like, you can't not have inflammation in your
Yeah,
body.
inflammation in and of itself is not the problem. Like
Yeah,
you're saying, we need to have inflammation, otherwise things wouldn't heal.
yeah,
It kind of reminds me of like when we start talking about walking, running, shoes, and stuff. The
yeah,
word pronation is like everybody's concerned about the word pronation. They're like, "Oh no, I'm pronating." I'm like, "Yeah, because that's what normal gait mechanics are. There is pronation that happens.
yeah,
We just don't want it to be too much or too fast or whatnot." Same with
right,
inflammation. We need to have inflammation, but we don't
right,
want it to be chronic, widespread, excessive. And what we know is a lot of the things that lead to chronic inflammation that we can't seem to knock out is poor sleep, too much stress, diets and nutrition that are filled with artificial processed crap that can sit on shelves for months and years without ever degrading. Like these things cause inflammatory problems in our body.
right, right.
And those things play a huge role in our ability to heal and recover
Yeah.
from all these things. So,
And the radial is more inflammatory because of the soft tissue, and the focus is more anti-inflammatory because it's a little bit deeper. And then we have
gotcha.
another device which I'll kind of go into, which is the electromagnetic transduction, which I think is very fascinating and similar to it's a form of PENF, but at a much higher oscillation frequency that it can actually recruit the cells to the area as well and really create that stem or the cellular proliferation with the magnetic technology.
Yeah. Well, right before we go into that, I think that would be cool to kind of like do some of this show and tell.
Okay.
Um, Let me just make a quick note on you were mentioning imaging. And I do think, being somebody like yourself, we're trying to keep people as much as we can from going under the knife, right?
Yeah.
Like, let's not cut open the tissue and have surgeries that we don't need to have because
Right.
what we know is true is that when someone goes in for a back surgery, the chances of them going in for another back surgery and another back surgery are really high.
Yeah.
And I've talked to spine surgeons that'll say that. They're like, we do not want to do surgery on this person unless we absolutely have to, because then the likelihood of them having multiple is going to be way higher.
Right.
Same thing with the shoulder. My dad's a great example. He had rotator cuff repair on both shoulders, and then he still tore his rotator cuff again, and he wound up now having a shoulder replacement. Like,
It's
ju-
crazy.
yeah, just because you have surgery on something does not mean that the issues are gone necessarily,
Mhm.
right? Like, someone could tear a meniscus, have the meniscus repaired, but if they don't address the root causes of like what led to that meniscus tear in the first place, hip mobility limitations, weakness in their hip, ankle mobility issues, like you may just wind up down the same path again because it's a whole chain, right? It all impacts one another, and it's not unfortunately just as simple as like, oh yeah, let's just cut it open, fix this tissue, and then all the problems will be gone forever. That's not the way that it works.
Yeah.
But with imaging, there's a time and a place for imaging, right? Sometimes we want to use it as a tool to help us diagnose if a problem is or isn't present based on the image. Does the person have a meniscus tear? Do they have a rotator cuff tendon tear? Um, but in the case of Shockwave, or even sometimes being like extremely specific with dry needling, sometimes it's nice to have that image so that you know what tissues to target with your treatment, right?
Yeah.
Like if
Yes.
you can be pretty confident without the imaging, but then you can like really dial it in if you have the clinical picture plus
Yep.
the image and you can pair those two things together. I guess I guess my main point in talking about that is it's a nice piece of information, but what I don't think any of us can do is you can't just simply hang your hat on that the image is like written in stone. You kind of have to take it with a grain of salt because there's people that have pain in joints, they get an image, and the
Nothing.
MRI comes back completely clean. There's
Yeah.
people that don't really have pain or they have very minimal symptoms. They go get imaging on something and it comes back with a whole list of stuff
Yeah.
that shows up on the image. And now it kind of like makes them more concerned and stressed out about it. They didn't even have that many symptoms to begin with, but now they have this MRI of their back, for example, that says all this scary stuff.
Right.
And now they're like, oh my gosh, I have, my spine is in terrible condition. But you have to remember, if you didn't really have any issues going into that MRI, it was just kind of a precautionary thing. The image does not always dictate like the trajectory of where we're going. So there's a
And I
lot of
think
people
too with
without symptoms that,
yeah, with injuries like this is, all of a sudden somebody's like, oh, all of a sudden I just did this and it happened to my knee. And you're like, actually, it's been happening for probably several years and it's been brewing and it's been weak. And then all of a sudden something happens. And it's always happening like what I'm 45 to 55, a lot of that age range where we're not focusing on our stabilizing muscles. And that's what we were talking about earlier on, where when you start working with a trainer, functional movement, all that stuff, you do feel stronger because we're activating all these stabilizers. And that's what keeps us like standing up. And when you are immobile and sitting at a desk, they're weak and asleep.
well, like you said, immobile and sitting at a desk, everything that's happening in our lives, I'm almost 35, but even from when I was a kid till now, there's so much technology that has been introduced that just makes our lives lazier and easier, right? It's
Really.
like rolling suitcases instead of carrying a duffel bag or a backpack, escalators, elevators instead of taking the stairs, where like you'll see obviously tons of able-bodied people that can easily go up and down the stairs, choosing not to go up down the stairs because there's something easier, an
Yeah.
escalator that'll take you there and not even necessarily take you there faster, but just sometimes slower than the stairs.
Right.
Um, but it's like it requires less effort for us to do, so we default to that. Or same thing in the case of computer chairs and all this stuff. So like our jobs and our lives are getting less active and more sedentary, and our issues are becoming more and more prevalent. Our
Yeah.
physical and orthopedic issues, our health issues and taking care of ourselves, our stress, our obesity issue, everything like that. So it's not a coincidence the trajectory
Right.
that we're on. It's not a coincidence that as people become less active, they deal with more issues when they do try to go do active things. They hurt things, soft tissue injuries and whatnot, because the tissues don't have the capacity to handle the
No.
stuff, the stress that you're asking them to withstand. So
Have you read that book? I think I told you about that book, The Comfort Crisis.
I have read that book. I listened
That
to
book
it.
is
Audio, big audio book
it's a
version.
good one, but it really just it stresses on all the things that you're saying, like
Yeah.
just being active and I've always been that kid. People are always like, God, you never sit still, and I was like, this is just who I am, and that's why I'm in the work I'm in. I want to be out in the field. I want to be moving my body, and I hope that as I age, I just continue to stay strong because and I know some people don't necessarily have that choice as far as a desk job and things like that. But, that's why I'm like, bring back trade schools, right? For kids, get
Yeah,
them moving.
totally.
Okay.
Well,
So I mean,
I know the I know the
okay.
type. I know the type of people that struggle to sit still. So
I
uh,
know, like,
we're
I know as
getting.
I'm sitting here going, do you want me to do something?
But yeah, let's do that. Let's do a little show and tell
Okay.
on these Shockwave devices and what they look like, what they sound like, and
So,
I think this will be fun. And now, if
yeah.
you're not watching the video version, what I would encourage you guys to do, of course, these podcast episodes are on all of the platforms, however you're tuning in, but also on YouTube on our Physio Room Co for Colorado Physio Room YouTube page. There should be a playlist that has all these podcast episodes on there. So I'd encourage you to go check that out so you can see this video demonstration. But as you're showing us, Kathleen, kind of talk
Okay.
us through it.
So, this is the radial gun, is what it's called. It's a radial device, and it has a tube in it, and there's like a little bullet. Actually, it needs to be cleaned off. Okay. And then there's different applicator tips. So this is a gold tip. So we have different tips where, okay, so We have like very large ones, which we don't really use this one that much, but this might be for somebody that is a larger individual that we really have to cover a little bit more of a broad range. But when you get into some of these smaller ones, this is the R15. There's a silver and a gold. The silver obviously doesn't go as deep. The gold goes a little bit deeper.
Gotcha.
And there's a tube and a bullet. And so it's technically what we call a pressure wave. And then on the gun, there's different settings where the top bar is, you know, the intensity of it, and then how many pulses you do, and it depends on the area. It's usually right around like, you know, maybe 1,000 to 1,500 pulses. And so what I will do is I will turn it on so you can kind of hear it. So it's percussive.
Sure.
So when you apply it to the skin, you have to use coupling gel to
Oh yeah.
transmit those waves through the tissue. Okay, so this one is loud, and this is generally what we're seeing a lot in like for physical therapy or just myofascial release, you know, those kind of things. Where even Eric, we're starting to use it with a lot of the chiro patients where maybe they've got some really tight QLs and he's not able to maybe adjust the lower lumbar or whatever that is. We can do a very light treatment with the radial to get some blood flow and to loosen up some of those muscles.
Yeah. Yeah.
That
Yeah.
makes sense?
Mm-hmm.
Yeah. So this is a radial, and this is what a lot of people generally will start with. It's obviously a little bit less expensive. It doesn't go as deep, but it can really do a lot of great things to, you know, the tendinopathies, the tendonitis, plantar fasciitis, all the itises.
Yeah.
um, which, you know, 3 to 5 treatments, and that's what we started with, is just the radial.
Mm-hmm.
So and
I
you
think that's
can,
what most offices like, unless somebody says, at least this has been my personal experience, when somebody starts just talking about shockwave, that's usually what they're talking about, unless they're specifically referring to like we have a focused shockwave device. But a lot of times I've heard someone talk about shockwave, and that's the most common version that I've seen used, heard people talk about.
yeah. And really, we, even us, when we first, you know, and I knew more about the technology because I was a patient, right, for so long. So I knew what the focus was, I knew what the radial was. But the term shockwave technology, they're both considered shockwave technology, but the gun is RPW, so radial pressure wave. It's still acoustically a wave because it's a sound, right, with the pressure.
Yep.
So that's what you're going to see in a lot of offices. But that does not regenerate stem cells. The cool thing about the focused is a little bit bigger. And so the focused, kind of the same handpiece. Hold on.
Yeah,
You can barely hear it.
very different head though on that device, and like you
So
were.
there's water in here.
Yeah.
So the focal wave you can see comes through there. This is all water. So it starts out broad and then it gets
Narrower.
focal. And this goes about 6 to 8 inches.
Yeah.
It goes really, really deep, but you can't really hear it. I mean,
Yeah.
you can
No,
hiding your clicking.
no, and when I remember experiencing it for those handful of sessions in your office, they sound very different too when
Yeah.
you're in the office and how you're
Mhm.
feeling it. Like there's a little noise, but the radial one makes much more of a noise.
Yeah, because it's air, it's pressure.
Yeah.
This has water, and it has to be combined with the magnetic transduction for that to penetrate through the tissue. Is
Mm,
basically what it is. So this is true focused, and this is radial. So they're very different,
for sure.
you know. And like I said, I think a lot of people, a lot of offices are doing the radial, and I think the radial is great. I just know now that I've been in the industry long enough that you want to make sure that, you know, you're telling your patients what it is, how it works, and what the true technology is, because ESWT is the broad kind of terminology just for shockwave. It's extracorporeal shockwave therapy.
Yeah.
And these are both extracorporeal shockwave therapy, but this is a radial pressure wave and this is a focus device.
Yeah.
So it's very,
Yeah. Yeah.
um,
Very different.
yeah. So then the third one that I want to just kind of show you guys real quick. This is
Yeah.
really kind of cool. Um, see if you can see it. There's we have a lot of stuff in our office. Sorry, we have
Yeah.
a tiny
That's
little space. Okay. So, see, you see it okay?
Yep, maybe. Yeah, perfect. That's better.
Good. Okay. So this has a big wand and it's got like these coils inside of it. Okay. So PEMF, which is pulse electromagnetic field, has been around for a long time. Magnetic transduction, magnetic therapy has been around for decades. I remember there was a company here in Denver called Feel Good, and you always used to see these magazines on the plane, which of course they don't have magazines anymore. We'd be on a plane and you'd look and they'd have all those things. I don't know if you probably don't remember that.
Yeah.
Anyway, you would wear like these magnetic bracelets. And the theory was that magnets create and attract blood flow, right? So this is called EMTT. So that's extracorporeal magnetic transduction technology.
Okay.
It's also called the magnetolith. This all German. All this stuff is out of Europe. But the really cool thing about this device is that it can regenerate bone and it can stimulate osteogenesis,
Very interesting.
which is really cool. So, and also it can help create some of these, I think they're mesenteric cells in the bone, which help with making the bone stronger, which I think is all kind of part of osteogenesis. But this device we can use, we always use it with the other two because what this does is that magnetic transduction penetrates the actual cell wall.
Hmm.
So if there's kind of old cells trapped in the cell wall, they can kind of recruit new cells to come in. And this is more anti-inflammatory. So if somebody just left surgery, so post-op,
Yeah.
acute, we're going to put them on this
Mm.
right away. And so you just basically can, put it on like, your shoulder like this. So if I turn it on, just clicking. Now, I always feel it in my shoulders. Most women and men will always feel it in the shoulders. And I'm just guessing because a lot of people probably do have inflammation in their shoulders just from injuries and just overuse. So oftentimes you'll feel it on the shoulders. And then sometimes like for women on their hips, they've been doing some research with the magnetolith for pelvic floor
Oh, very.
stability. I don't know a ton about it. The other thing that they have done recently in Europe is the focus device and this kind of combine. They have a new device called the Neurolith, which
Okay.
they're using on the brain
Interesting.
to rebuild muscle and I think it's to stimulate muscle growth in the brain for like Alzheimer's patients or
Yeah.
um, like traumatic brain injuries. It's called the Neurolith. I think it's in the States. I'm not positive, but it's really fascinating. And the other thing that's really cool, and I'm really proud to say this, is we are maybe one of 4 or 5 providers in the entire state that have this. So
Colorado. Wow.
yeah, so with OA, which I learned a lot about OA because we're seeing a lot of that, and you can correct me if I'm wrong, but what I've learned about OA is that it's edema of the bone because the bone actually becomes inflamed.
Yeah, and I think what a lot of people want to, I don't, how do I want to phrase this? What a lot of people think, and it's because sometimes they've been told this, is that osteoarthritis is just, I'll use put just in quotations, wear and tear of the joint. And we
No,
know that that's not true because
right,
itis is an inflammatory problem. And
right.
there are plenty of people that are extremely active that have put a lot of stress and demand on their joints that don't have necessarily significant arthritis issues.
Mhm.
There are plenty of young people that do a really poor job of taking care of themselves and their body that have other health condition issues, obesity, metabolic syndrome, et cetera, high stress, this and that, who have arthritis at an extremely young age.
Yes, that's
Not
so
because
crazy.
and it's not because they've put a ton of wear and tear on their joints, right? They
Right.
might be 25 years old or something and not have a very physical lifestyle. It's not good. It's not because wear and tear. So it's um it's a whole host of issues that
Yeah.
do cause arthritis, osteoarthritis. But yeah, the bone is definitely affected. So what can somebody expect to we kind of talked about like what Shockwave feels like and this and that. What can somebody expect to feel with like the EMTT?
So it really feels, and I know you've never felt. Did I ever put it on your shoulder? I need to do that
Not
next.
not on the shoulder. We've done it down on like the
Yeah,
calf
you're not
and
going to
the
feel it down there,
yeah,
right?
calf and ankle
It
area.
like when I do it on my shoulder, it feels like this deep pulse.
Mm.
right? And like sometimes you can see like my pecs twitching or things of that nature. And sometimes when you put it, anywhere on the shoulder, you're going to feel it. I sometimes will also feel it on my sacrum,
Oh,
like my low back. I probably have some inflammation. I'm on my feet all the time. I'm older, whatever. But with the EMTT, what's interesting is a lot of people are like, well, I don't feel it. Is it doing anything?
yeah, yeah.
But it is. And what they're using this for a lot in Europe, again, this is all very mainstream, is they have a lot of these devices in Europe so that when people come out of surgery, right out of surgery, they get them on this
Mm.
because it can start to recruit those cells and get that inflammation, somewhat under control. So post-op is really good. And we've had a patient in here today. She came in, both of her knees need to be replaced. And
Mm.
we did, I think, 4 or 5 on her right knee. We got her to 80%. And I just wanted to do her right knee. That's the other thing about this technology that I'm learning. Any feedback is welcome, is I think the body can only heal so much at one time.
Yeah, sure.
Maybe, right?
Yeah, I think you're right. Like we're sometimes I like to think of or use the analogy of like we talked about the body's always in this state of like trying to heal and repair, but it can only do so much at once. Like
Right.
if there's say there's a major stretch of road or something that needs to be repaired, the construction company that's going through doing all these repairs, they can only do so much at one time.
Mhm.
They're going to
Right.
gradually make their way and fix the issues or change the infrastructure or whatever it's going to be. Our body's kind of the same way. Like a small injury, of course, is going to heal faster than a large injury, and that's a good
Mhm.
example of like, well, you can only heal so fast. You can only heal
Right.
so much at one time.
Right.
And kind of like the same analogy of like information overload. You can only take so much information into your brain and boil it down and handle it. It's kind of the same thing. Like your body can't just like heal your shoulder and your neck and your low back and your knee and your ankle and your hip like all at one time. Now, my caution was sort of saying that is what we don't want necessarily. Like if someone walks into our office and they do have a variety of different issues, we also don't want to treat them in a vacuum, right? We don't want to treat these issues in isolation. We want
Right.
to treat them in conjunction with one another
Right.
because we know how movement patterns and things like they all impact one another. So we want to address as much of the full picture as we can, knowing that it's going to take a while for us to completely clear this up. But we don't want to like go, let's treat your ankle, and then let's treat your back, and then let's treat your shoulder, and then let's do
True.
this. But
Yeah.
sometimes that's what folks think is supposed to happen when they come in. They're like, well, this is my main priority. I want to fix that first, and then we will move on to the next one. I'll say, okay, well, we'll prioritize that because I understand that that's the most important pressing thing for you. But we got to not ignore these other things along the way
Right.
because they impact that primary thing. So,
Right.
but yes, yeah,
And this goes about 6 inches. This goes really, and the oscillation is really high. So it's moving really fast, which is kind of interesting.
mm,
And so we encourage people. So sometimes if, let's say again, we've had people with like a sprained ankle or a broken foot, and we get them on this thing, maybe 4 to 6 treatments, the bone will heal up to 40% faster.
interesting.
Yeah, which is really cool. We had,
So there's like magnetic energy kind of passing through those coils that are inside there. Yeah,
yeah, and I wish I had. And what's funny is if I had a true metal paper clip, I
yeah.
could I could stick it in here and it would spark.
I remember you showed me that. Yeah,
Yeah, yeah,
definitely.
yeah.
Like we
So
put
I wish I
the
could have done that today, but we went and we bought all these paper clips and none of them are all metal. So we have to like find the paper clips. And then our light always kind of twitches in here too, which is kind of interesting. But yes, the magnetolith, I think it's really a fascinating tool. And so we'll use it as a standalone.
Mhm.
Especially like again, post-op stuff. You get people with hip replacements, knee replacements, whatever. Get in here, get on this thing. Let's get the cells active. Let's get the cells to the area of healing. And then maybe 6 weeks later, we can introduce some of the soft tissue stuff, like with the radial and the focus, just to get the things to regenerate faster.
Yeah, totally.
So,
And like you said, getting things to regenerate faster, I don't want to gloss over the fact that we talked about we live in this like we want things done now, microwave type of society. If you can speed up a healing timeline, like most
yeah.
people are going to want to do that. Of course, there's finances involved and everything like that. But what we're really starting to lean into, your guys' office, our office, is we've had a few clients now that we've had the opportunity to work with together and
Yeah.
collaboratively. Like,
Yeah.
uh, we've sent a couple people your way, you've sent a couple people our way to kind of approach this from a full picture standpoint. Like, we're doing the chiropractic care, we're doing the Shockwave and EMTT, we're doing the physical therapy and the movement and the exercise based
All of it.
things. Like, we're addressing this from like all of the different angles and categories. And what we're seeing with those people is they're responding really well to that, like
Yeah.
overall. So yeah.
And I think, the cost thing, right around 275 a session if we're doing all three. If we're just doing this, it's 50 to 100 depending. Sometimes we'll just do like radial with Eric for Cairo. That's like 50. So there's definitely a variance in price, but I said this, on Sarah's podcast, and I will say this till I'm blue in the face, is you cannot put a price tag on your health because, and maybe you and I talked about this, but if you don't work towards, trying to take care of it now,
Mhm.
it will turn into a giant problem that
Yeah.
may not be reversible
Yeah.
and will really affect your life in the long term.
Yeah. I forget, depending when this podcast actually goes out and whatnot, there was one that I recently did that recently went out, and I think I said something to the effect of like, you will either choose to invest in your health and wellness now, or you'll be forced to pay for your sickness and disease later down the road. And what I mean by sickness and disease also includes orthopedic, physical
Yeah.
related issues, not just actual
Right.
systemic problems. But it's totally true, and I fall right into this category where like if I would have taken my Achilles tendonitis problem extremely seriously from the get-go, it probably wouldn't have turned into the challenging last several years
You
that
didn't? I
I've
don't
had.
know that. I forget the story behind it.
Well, with the
You kind of
story,
let it go.
the story probably was I had an unnecessary surgery that, looking back on this, I won't name any names, but the ankle surgeon that did the surgery on my ankle, quite frankly, was probably a complete waste of my time. Did not address the actual issue that was present. I had an injury to my ankle, but what was done in the surgery was probably something that was had like a little bone chip removed, not a chip, a little piece of bone removed. That was probably there before I had the ankle injury, but I didn't know that at the
Yeah.
time. So,
Yeah.
anyways, I had a surgery that was probably unnecessary looking back at it, but I didn't know the things that I know now. And then coming out of the cast, the boot, the immobilization period from the surgery is when I developed Achilles issues because I lost a ton of range of motion from all this immobilization. And I actually wasn't even referred by that particular surgeon to physical therapy, which completely blows my mind. I'm like a 22-year-old guy, and I have now terrible ankle range of motion in this surgical healing that we're trying to take place. And they didn't even refer me to rehab. I basically referred myself there. And then, well, that's when I developed Achilles tendonitis, trying to get back to all the things I was trying to do, run and lift and this and that. And it was just one of those things that I just didn't take it that seriously. One, because I didn't have the education that I have now. And two, it wasn't bothering me that much, right? It was just
Right.
there. And I waited until it got really bad to now I can't run the same. I can't jump the same until I finally started to do something about it. And if I would have taken this serious from the jump, probably would have had a much quicker healing timeline, much less time off of things, much less money spent, all of the
But
above.
when you're like 22,
I was in my early
so
20s.
there's that. You're like, I'm fine. It's all good. Which you probably, being young, that's part of it too. But yeah.
Yep. So yeah, you're totally right. Of course, we'll say this till we're blue in the face. You can't put a price on it because until you can't do something or until you don't have something related to your health, it's really hard to understand how valuable that is. And anyone who's significantly lost an ability of function or anything like that, like what that feels like, and it's dramatic and it's traumatic and we all just want to be able to do the things that we want to do when we want to do them. And in order to do it, we need to really take care of ourselves and address things so that they don't become bigger problems.
Yeah, and the other thing I just wanted to kind of mention is I think our society is really apt to, if there's something wrong, I'm going to go to my primary.
Hmm.
Well, primaries are good, but if you have a shoulder issue or a knee issue, like just go find a PT or go to a chiropractor or go to like do all these other things because you immediately will go to a primary and you're like, oh, go see this orthopedic. Then you go to the orthopedic. Oh, go get an x-ray. Then you get an x-ray. Oh, you got to get an MRI. Like it just is without really finding out what's wrong.
Yeah.
And I think people that like in your industry or my industry or whatever is we're hands-on people's bodies all the time,
All the time. Yeah. And we
you
talked about
know?
at the beginning how like nobody is an expert in everything.
No,
Like you said, the primary care provider's job is not to be an expert in
no,
the orthopedics and musculoskeletal stuff of the shoulder. They're there to help people with, the common issues, the illnesses and the this and that, and to be like a
right,
quick triaging of, sending people to the specialist for the things.
right,
That example that you just laid out is so common. And sometimes it even starts at the urgent care office. It's like you go to urgent care and then you get sent to your primary care and then you get sent to the ortho and then you get the x-ray and the MRI. And the thing that really cracks me up is like you get the x-ray before you even see the orthopedic, and the physician didn't even make the clinical judgment call, clinical decision to say, yes, you need the x-ray. Half the time, those x-rays don't show anything in all of the situations that we're talking about, these soft tissue injuries and stuff. The x-rays are oftentimes a complete box checking scenario for the insurance companies.
yeah,
And,
which
they,
is maddening.
yeah, it doesn't
Mad.
really enlighten our clinical picture, our understanding of anything. Um, it's just checking the box. So sometimes that period takes a lot of time, right? We're all super busy. We've got stuff going on. We've got families. We've got kids. We've got jobs and hobbies and things we love to do. If you're going to take weeks, sometimes months, to go see all these different providers and get all of these different things, like sometimes you can't even get into these providers for weeks
Right,
or months.
right,
We're just delaying addressing the problem. And then
right.
our body's laying down scar tissue.
Yep,
We're
yep,
moving the area that's bothering us. We're getting stiffer. We're developing more issues and compensations. And now this problem becomes harder to address.
yeah.
And if we just would have like gone to the right person from the get-go, instead of all these other steps to finally get to that right person, we could have already maybe had it solved or healed or
Right.
like we could have been so much farther along the process at least. And what we're not saying is don't go see your primary care provider. That's not
Right. No, 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 not at all.
not what you
But
should hear.
yeah,
But they would agree they're not the knee expert, they're not the shoulder expert, they're not the
mhm,
foot expert. That's not what their job is. That's why they're specialties of all these other things. So,
mhm.
um, yeah, you got to get to the right person to help you with the issue that you're dealing with.
Yeah. And then one more thing I do want to just, announce it June 1st, hopefully. There's a whole aesthetic side to this technology and the focus device you can use on your face and for stem cell recruitment and skin tightening. So I'm super excited about that. And then the radial, I don't know how much we're going to get into this, but this is kind of non-invasive stuff that I think some women are seeking instead of, I've obviously done, resurfacing and lasers and things of that nature. But the great thing about this technology is you can do some of these things and then you can use our technology to support those benefits and age in a way that is non-invasive, kind of thing. So that's really exciting and they're super easy. They're like 15, 20-minute treatments. They're seeing people are seeing results after 3 sessions, which is awesome because it's really there's just not a lot of fat right on the face, and so the collagen really starts to plump up and things of that nature. So that'll be another podcast, hopefully with like an esthetician or something like that, because I do think women are seeking that kind of stuff, and it's not as expensive as some of these other treatments that you're spending $2,000-3,000 on, which are great, but if it's a little bit less, there's no downtime, right? That's a big thing too with people is no downtime for any of this stuff, unless obviously downtime. If it's an acute thing, they come in, they're seeing you. I mean, you got to have the body heal with just the regular soft tissue stuff, but for the face, there's no downtime.
Yeah.
But I'm excited about that too. So
Well, I mean, at the end of the day, we all want to look good. We all want to feel
we're
good. We
good. Yeah.
want to perform good in the things
Yeah.
that we want to do. So it's cool seeing technology come around that allows us to help improve those things,
Yeah.
especially when it's something that's more holistic and natural, right? Instead of like putting stuff on or in our body that has all these negative side effects and
Yeah.
whatnot.
Yeah.
Yeah, I love that. Well, Kathleen, I think we could talk about this all day.
I know, no, this was perfect. I love it. I'm so
We saw
glad we
each
got to do
other
it.
yesterday and we were sort of talking about how we were going to steer this conversation. And I think we completely hit the nail on the head in terms of, going over this stuff. What I want to do is make sure that the folks that tuned in to listen to this episode, which thank you again, but so that they know how they can get in touch with you. So what's going to be the best way online or whatnot for people to find you guys? And
So, I mean, regen3therapeutics.com. We have a landing page. We're still kind of building our website, but that has all the information on there about all of our technology and our location. It's super simple. My website, Link Golf and Wellness, I also have information on there about our business. You can also just look up Kathleen Heiney. My number is on most of our marketing materials that you can call me directly and steer you to the office. And usually what we try to do is we want people to come in and do what we kind of call a consult we do an exam and a consult with what we call a discovery treatment, which is really great. It is only 99. So for $100, you can come in and we can just assess the issue before we put together a treatment plan or a protocol. And we have really found that to be helpful because we can educate people on the technology. We can do the discovery treatment and we can tell them if they're a candidate, they may not be, right? This may not be for you. I think it is for everybody, but there are times that it's not. So that we encourage people to do that as well. So,
yeah,
and then we'll be at Lion's Den on next Monday night, which is
we
right where
will.
Physio is doing
Yeah,
demos.
I don't think this will go out in time, but I think it's
I
awesome
know, that's
that you're
okay.
going to be here for an event, and I don't think it's unrealistic to think we will team up for some other events together
Yeah,
in the future.
for
So,
sure.
yeah,
Okay.
I encourage you guys, whether you're local here to the Denver, Colorado area or you live somewhere else, I
Yeah.
definitely
Look
think
up
it's
Shockwave.
worthwhile to go check it out as a piece of the puzzle of a well-rounded rehab and fitness routine. Like, so many of us are dealing with nagging issues that, don't want to resolve, and you feel like you've tried everything. Hopefully those things that you've tried are not just rest and ice and ibuprofen, because those aren't going to fix the
Right.
problem, but combining
Right.
the active rehab side, like with physical therapy, combining the treatment like shockwave, like dry needling, like chiropractic care, all these
All of
things that
it.
are going to facilitate this healing response and working on the strength and the mobility and regenerating that tissue. That's where I think you're going to see for these common musculoskeletal issues a lot of movement in the direction that you're looking for. So I thought this was
Cool.
awesome. Kathleen, thank you so much for
Thank
joining me
you.
here. I really appreciate your time this afternoon. And we'll put all that information that she just shared, the websites and things in the show notes for you guys. But until next time, Dr. Andrew Fix signing off. Thank you again for joining us
Okay.
on the
Thank
code.
you.
And we hope to catch you guys on the next episode. We'll see you later.
Awesome.